Hi, welcome back to our series on exploring dance. Last week, we talked about the 5-step process to choreographing. This week, we're going to talk about the concept of dance therapy and how it relates to the mental and physical wellness of an individual. So first, I have a few questions for you guys. My first one is, what is dance? What does that term mean to you? What pictures do you get in your head when you think about dance? Next, why do people dance? What do they get from that experience? My next question is, what is art therapy? And why does dance fit into that category, and why is it beneficial?
Sing. 1, 2, 3, 4.
So now we're going to watch a quick video introducing the topic of dance therapy.
Hi, my name is Dr. Lori Baudino. I'm a licensed clinical psychologist and a board-certified dance movement therapist. And I'm here at Mattel Children's Hospital at UCLA. And I was brought to the hospital to provide the first dance therapy program funded directly and solely by the Andrea Rizzo Foundation. Dance movement therapy is not only the use of movement, which a lot of people can hear the word dance and think, oh, you must be teaching ballet or tap or jazz. But the reason why we add that movement piece on is because movement in dance can be anything from breathing to the way our heart beats, to the way our posture is when we're sitting and communicating, the way we hold ourselves, the way a mother or family member might hold a child. These are all ways of moving and expressing, and movement is our innate way of communicating. It's something that we all naturally do. Whether you speak any different languages, everyone moves. It's something that we're all united with. When I think about the goals of the treatment here at the hospital, I'm looking at sometimes very short-term expectations, giving the child a distraction for that moment, for that day, to have an experience other than what they've been experiencing at the hospital, is one, kind of on the surface part of the therapy, going in there and giving them a place to be and experience some laughter and some play. It gives them an opportunity to express and feel safe to share some feelings that they might not be able to talk about, or it might be difficult to talk about. And the goal is really to hopefully get them to a place that the more we expand our movement repertoire, the more individuals able to express themselves through the body, the more language comes out, the more they're able to access these feelings and really articulate them. Whether it's just through moving, like really showing that movement in their body, or really finding the exact word that I might have to help them find. And then through that, finding a way to cope and recover from those feelings. How do we solve them? Where can we look for help? How do we, find a way to breathe and get through each step along the way? The movement that I do in all the sessions, not only is it accessing the emotions, but it also physically helps the child and the individual, because it's physical movement that these children don't get to do. So they are strengthening their bodies, they're learning, they're being more flexible, they're being more malleable, they're reaching and stretching in different ways that they might not feel like they can do, but all of a sudden with creativity and with movement and play, they can do the movements. The more we release these feelings, they stay outside of us. We have more control over them. We can integrate our experiences. We can adapt, be more adjustable in our lives and more adaptable, so that they're able to handle all the challenges that are along the way.
Hopefully you guys enjoyed the video and that you kind of got a better idea of what dance therapy is and saw it kind of in a way that you may not have thought about it before. Dance therapy, essentially the reason why it's important is because it helps someone on both a mental and physical level. It kind of transcends most traditional forms of therapy, whether it be, just traditional like talking to someone or physical therapy, because it kind of addresses both emotional and physical needs. So it really is very versatile with what it can actually go to treat.
It's one wicked road, you gonna make it right. You found your way to go, you gonna take that right.
Dance therapy is defined by the American Dance Therapy Association as the psychotherapeutic use of movement as a process that furthers the emotional, cognitive, social, and physical integration of the individual. Psychotherapeutic means the psychological treatment of mental disorders. This definition is based on the idea that the body, mind, and spirit are interconnected. Dance therapy can be beneficial to anyone. Specifically, dance therapy is helpful for individuals with developmental, medical, social, physical, or psychological impairments. Dance therapy improves communication, self-awareness, and expression, and it also is a good form of exercise, which releases chemicals in the brain that provide a sense of happiness and may create a lighter mood. It also physically strengthens your body and changes it in positive ways. Dance therapy is good for patients with schizophrenia, eating disorders, communication issues, abuse, violence, trauma, cardiovascular disease, chronic pain, hypertension, mentally disabled, people who are suicidal, visually or hearing impaired, autistic, chronic fatigue syndrome, dementia, depression. So basically, it kind of encompasses a whole bunch of patients, which makes this a very good treatment for a lot of different reasons. Dance therapy is being used in mental health facilities, rehabilitation, medical facilities, educational and forensic settings, nursing homes, daycare centers, disease prevention centers, health promotion programs, and also in private practice. Traditionally and formally, dance therapy is administered by a therapist, much as you saw in the video earlier, and typically the therapist will work with the patient individually, kind of assessing their individual needs and figuring out how they can apply movement to help them through whatever they're going through. The therapist sometimes will lead a structured improv. The therapist will guide the patient in directed exercises or activities, much like the children. Then the therapist will kind of analyze the movement and maybe talk with the patient afterwards about what they can improve upon, how their movements speak to what's going on deeper within themselves. So the last thing I want to talk about is why dance therapy is important. Like we mentioned earlier, it's for the physical and psychological well-being of the individual. I have personally seen the benefits of dance therapy just by being a dance major and experiencing the effects that movement have had on my body, both definitely physically and mentally, because through exploring more of like creative dance and improv, you really do discover your own voice and kind of uncover feelings or emotions that you kind of bury within yourself and may not always come up with words or, through traditional means of communication. So basically, there have been a lot of medical studies that have proven the results from dance therapy. There have been, as I mentioned earlier, the rises of the chemicals in the brain that make the patient happy. So that can serve as a temporary benefit. Also, the cardiovascular benefits and the muscle building benefits can be good for patients who need that. Also, balance, range of motion for maybe victims who have suffered kind of the loss of movement of a body part or something like that. So now, based on what you guys have learned from this session so far, we're going to do an activity. I'm going to lead you through a simulated therapy session, and then afterwards you are going to write about the specific benefits that you have experienced either physically or emotionally from this experience. And it can basically be you write about anything that you see. Alright, so let's get started. So hopefully you guys enjoyed that activity and you got to experience some of the benefits yourself of dance therapy and how it affects physically and emotionally. So in summary, we learned today that the dance therapy is defined as the psychotherapeutic use of movement as a process that furthers the emotional, cognitive, social, and physical integration of the individual. We talked about who dance therapy benefits, we talked about where it is being administered, we talked about how it is being administered, and we talked about why it is important as a whole. So now we're going to have an evaluation, and I'm going to get you guys to answer a few different questions, and you have about 10 minutes to do so. So that's all I have for you guys today about dance therapy. Last week we talked about the 5-step process to choreographing. This week I hope you guys got a pretty good idea of what dance therapy is and how it can be beneficial. So next week we're going to talk about how technique fits into these two kind of creative and abstract processes of dance.